Welcome to Eagle Health. I am Prasad Vannam Reddy. I am a neurosurgeon. Today's topic is about headaches. Headache is a very common symptom and everybody experiences headache at least once in their lifetime. And some of us experience this headache more than often compared to others. Common causes of headache might be very innocuous kind of headaches which come and go, and then they get relief by taking even simple medications like your day-to-day used paracetamol or ibuprofen. But there are some times where headaches do drive people to crazy kind of situations, and especially some of these headaches make people cry. And sometimes the headaches also make people take leave from their work and then produce loss of economy to the person, to the society, and to the country also. The innocuous headaches, that means the not life endangering kind of headaches, include those which are because of common cold, sinus infections, sometimes eye infections, sometimes vascular headaches like migraine, hemicranial headaches. The most dangerous thing is brain tumors, or any other kind of inflammation or infection or tumors involving the brain and their surrounding membranes. The headache as a perception is because of irritation of the cranial nerve called the fifth cranial nerve. It's the trigeminal nerve. Trigeminal nerve carries all the pain, pressure, and on the nociceptive signals from the body. These nociceptive signals give you the what you call as the perception of headache, because the terminals ending from the trigeminal ganglion and from the trigeminal nerve include ophthalmic division that goes to the eyeball and surrounding structures, and the maxillary division which covers most of the face, and the lastly mandibular division which comes to the mandible. And part of these trigeminal nerve also goes to the back of the neck, and that's where people sometimes, even though it's produced by structures close to the brain and its neighboring structures, experience back pain in the sense that upper part of the back, that is the nape of the neck. Nape of the neck pain also is carried by trigeminal nerve, and sometimes down the line it is carried by something the special nerve called occipital neuralgia. The occipital nerves are greater and third occipital and lesser occipital nerve. There are different divisions, but the major contribution to the occipital nerve comes from the upper cervical spine, that's C2, and some segments from C3. Occipital neuralgia is most often mistaken as neck pain, and people get unnecessarily investigated for cervical spondylitis or spondylosis, which is a very kind of misleading diagnosis. Occipital neuralgia is entirely because of the muscular contractions of the muscles of the back, which kind of compress the occipital nerve and produce the pain. And rest of the things, once we cover the occipital neuralgia, is about the front of the head, the scalp, the top portion of the head, and then the eyeballs, and then structures above the eyeball like forehead. Forehead pain is usually because of frontal sinusitis or paranasal sinus inflammation, that is nasal sinuses around the nose. They have close communication with air cavities around the eyeball, air cavities behind the nose, and air cavities within the scalp. These things are very commonly affected because we all breathe air. And once you don't breathe clean air, or once you breathe polluted air, you get headache. It's a common experience that whenever you have dusty environment, or when there is a lot of contaminated air and you breathe it like smoke, some house is burning or something. In this country, most often you see everything is burnt on the road, like tires, trash, or some kind of junk. People are in the habit of burning them down on the street, and then with kind of as an effect to the society, people in the neighborhood keep inhaling that smoke, which is very dangerous to lungs as well as to the upper sinuses. And once you do that, by the evening, most people complain of headache because the sinuses get damaged. All these sinuses are supposed to protect the human body by controlling the temperature. They have a small flagella, which are hair-like things within the sinuses that keep controlling the movement of air, and then they do produce some kind of what do you call the turbulence, and sometimes they regulate the temperature also. Because of the heaviness of these particles in the smoke and the dust, these things get damaged. Once the air is not going freely and oxygen is not getting absorbed properly, first thing to warn you is your brain. So there is always some pressure changes and blood flow changes that occur in the brain and outside that gives rise to headache. Most often this headache gets relieved once you take some maybe head bath or take a shower and then cool yourself and then relax. By the next day this goes down. But this can get worse if the same thing you inhaled the day before contains bacteria, or the so-called common things these days is virus. So once these things are getting settled inside the body, they give rise to temperature or sinusitis or sinus infection, which gives rise in turn to headache, and then it drives you to a doctor, and then invariably you end up taking antibiotics along with some pain management or temperature management medication. That will bring down the infection and inflammation, then the headache comes down. This is a very common experience. Everybody gets this, not that somebody is excluded. No, not even saints can get away from this kind of problem. And the other thing that is very commonly seen is stress. We should not call stress. Stress is a very vague word. Stress is something that everybody handles. Everybody is in kind of taking pressures of their life, pressures of their work, pressures of their family and everything. Stress is something you face in work, in your studies, in your life and in your relationships and in every activity in life. These things sometimes when they are beyond your control or some things which are beyond your management skills, then you get what you call tension headaches. Tension headaches are mostly because of your problem which is not able to get a solution there. Problem is like somebody defined, problem is something until you find a solution. So finding a solution gives you the headaches. These are not something very serious inside the brain or inside the head or inside your heart anywhere. These are something which are inside your thoughts. You are unable to solve a problem, then you are still finding for a solution which is sometimes difficult to get. Then you get these tension headaches. Tension headaches make you clench your teeth, breathe heavily, or sometimes close your eyes tightly, and all these things produce tension or stretch on your muscles of the face, muscles of your neck, muscles of your body. Whenever there is unnatural pressure on the muscles, they get aches. These are like body aches. Tension headaches that way are nothing but muscle stretch, muscle ache, and then body pain. They all translate into headaches. The solution to this is your problem getting solved as easily or as early as you can. Or more serious things are related to muscle stretch or blood vessel issues, where some of these people have got blood vessels that are highly sensitive to different kind of changes in temperature, changes in air pressure. That results to the vasculitis or arteritis or venous inflammation or something. Sometimes they are called vascular headaches, and migraine is one of those headaches which produce very troublesome things, because these people, when the migraine sets in, cannot even face the light. Even a natural light of the day gives rise to migraines, headaches. So you probably have heard of some people getting into a dark room and taking rest the entire day, or probably trying to get sleep the entire night. These things are usually the vascular headaches or so-called arteritis things may have sometimes structural abnormalities. So it's always better to get investigated by a specialized headache specialist, who is often a neurologist, who is supposed to have some knowledge about these headaches. These people will try to understand your issue and try to get the investigation done. Once you get that, there are a lot of medication which are vasodilators, and then they produce the correct kind of blood supply to your muscles and then to the scalp, and that will give you the relief from migraines. And there are other specialized kind of names to several headaches, like hemicranial headache, parsvanopy, or half of the head is getting pain, or other kind of headaches are there, which are mainly they require intervention by some specialized neurologist or a neurosurgeon, or who are pain management specialists. As I said earlier, trigeminal nerve is the specialized nerve that carries sensations for pain and nociceptive signals. Why I told you about trigeminal nerve is now that nerve is being investigated thoroughly in developed countries or educated countries. And then now we have something called nerve stimulation. Peripheral nerve stimulation has been tried for 30-40 years now. And then once you introduce an electrode to deliver kind of structured electricity in a kind of specialized wavelength, specialized time, and specialized ampere strength, they can modulate the nerve that handles the pain signals and then give relief. This is thoroughly studied by many people in United States, in Canada and UK and Europe also. And most of the times these refractory headaches, that means refractory migraines or refractory hemifacial pain, you can find relief from these neuromodulation varieties. And the most serious thing, which is because of tumors inside the brain, require a thorough investigation, and they are specialized because even the headache is very special. The headache is very special in the sense you get pain early in the morning hours, like around 3 o'clock in the morning, because when people are lying down, the carbon dioxide levels are high. When you are breathing, usually when you are sleeping, your breathing is shallow. It's not as rapid as when you are walking or talking or standing or doing work. Once the shallow breathing sets in, the carbon dioxide levels inside the brain go up. Carbon dioxide by nature is a cerebral vasodilator. That means it increases the blood flow to the brain. So everybody gets increased blood flow, not just the people with the brain tumor. But with people having a brain tumor, there is already a space occupied with the brain tumor that does not allow the brain to expand as normally as it does in normal people like you and me. So then when the brain tumor is not allowing the expansion of the brain with the increased carbon dioxide, it suffers the pressure. Brain does not feel any pain or anything, but the surrounding structures like membranes covering the brain, the blood vessels, the bone, they are pain sensitive structures. Once the pressure is increased because of the brain tumor, these things start getting the impulses. Then people wake up. So these early morning headaches in these people around 3 o'clock or 4 o'clock in the morning are very dangerous. Usually people get up, they have severe pain, and most of the time they vomit projectile. There is no time for them to get nausea or do any kind of associated activities. They just vomit immediately. And then that gives some relief to these patients, because once they vomit, the pressure comes down. Once they are sitting up, the carbon dioxide comes down, and then they get relief. These things you should immediately rush the patient to the doctor. Usually children get up in the usual parents say middle of the night. Not the middle of the night, it's early hours of the morning. So if these things happen to the kids, don't neglect. They should take them to the doctor, the trained doctor, and get them investigated. These are very dangerous things. Otherwise, as I said, most headaches are very innocuous, very benign, and they can be easily controlled. The thing is, you should know how to handle your life, your daily routine, your work, and your other kind of issues regarding your work environment and job. Then you'll take care of your headaches. Thank you for listening. Bye.
Like and subscribe Eagle Health and Beauty.